When it comes to state laws, it's important when you're moving from state to state to really understand the Dental Hygiene Practice Act. So today we're going to cover the Practice Act, what it is, what it means for you, and how you can seek out that information. I want to give a little disclaimer that this is for the state of South Dakota. That's where I am. Many states have similar structures. So this will be a basic overview of just what that structure might look like, but it is essential for you to do your own homework and make sure that if you're going to a certain state, you reach out to the Board of Dentistry or whatever governing board they have in order to really understand this. Hey everyone, welcome back to the channel. Today we're going to be talking about Practice Acts, why they're important, and if you again have any questions about that, the best thing to do is reach out to your governing body. So let's get into Practice Acts. Practice Acts are the defining laws and rules that you have to follow when you are working as a dental hygienist. It's really important for you to understand whatever state Practice Act you are in and have a license in. Your license is essentially your ticket to your career. And so protecting your license and making sure that you understand the governing body that gives you a license is essential. First, we're going to define what a governing body is. A governing body is what gives you your license. So this is a team or a committee of people that govern your profession. And in South Dakota, we have a Board of Dentistry. I know in every state, it's probably called something a little bit different. I know some have a Board of Dental Examiners. Some states even have a Board of Dental Hygiene specifically. Some states fall under like a Board of Health or a Board of Medical Providers or something like that. But just do some homework and understand what state you're going to. Again, South Dakota, we have a Board of Dentistry. In South Dakota, that Board of Dentistry is made up of 5 dentists, 1 dental hygienist, and 1 layperson. So a layperson is somebody from the community that does not have a background in dentistry. And that's important because the whole point of a governing body is to keep the public safe. So the mission behind these boards, again, is to keep people safe. And they do that through a number of ways. The first way that they do that is that they make sure everybody that's practicing under their Practice Act is licensed and qualified to do the work that they're saying that they're doing. Now, licensure can come with a bunch of different requirements, but most of those requirements do ensure that you are qualified. Now, that could be graduating from an accredited university. It could be passing a jurisprudence exam in your state so you understand the laws. It can also be, for dental hygiene specifically, a clinical board or a national board. Every dental hygienist that's working in the US has to take the National Dental Hygiene Board exam, and typically, depending on the state, they have to pass a regional clinical exam. Now, that has changed a lot since COVID. Because of COVID restrictions, many states decided that they felt comfortable doing a simulated exam, so not on live patients. Now, because of that change, I think a lot of states and examining companies have decided that simulated exams are feasible and do test skills just as good as a live patient exam. So a lot of states have kind of moved towards that to stay. Now, because things are changing so rapidly, I don't want to make any claims on what we could see in the future, but we may see most states going to clinical simulated exams. Another thing they do is enforce statutes or laws and rules. So that way, if anything happens or complaints get made against you, they're the ones that are looking at it and saying, I wonder why they did this, or this isn't evidence-based. And so they're really a barrier for the community, for the public, to make sure that all of the clinicians under their licensure are following the rules. Typically, Practice Acts have 2 different types of rules and laws. So codified laws or statutes are actual law, meaning it requires a bill, some sort of piece of legislation to actually go through the Senate, the House, and get written into a law. And so that kind of defines our practice, and it defines what we are, who we are, and what kind of profession dental hygiene is. That is, laws take a lot more effort to change because there's a lot of checks and balances, and that's a good thing. There's other types of regulations, and those are rules. Rules are things that kind of clarify the law and things that help us understand the law and understand what we can and cannot do that don't make it to legislation. So those are rules. Those might be like our fees for licensure renewal, our CE schedule, and how many continuing education hours we need. Stuff that's a little more down in the nitty-gritty that isn't necessarily worth it to get into law, if that makes sense. What's really important is, in order to understand your scope of practice, so the scope of practice is what you can and cannot do. Many states have levels of supervision. Now, because we're dental hygienists and we work under the supervision of a dentist, this is really important for us in order to practice within our license. Now, there's different levels of supervision, and those levels are defined differently in every state. Again, that makes it hard to go from state to state. So I'm going to be talking about those specific supervision levels in the state of South Dakota. They may be similar to other states that you want to go, or they may be way different, but make sure you understand the levels of supervision. So this video is being made in January of 2025. So take that with a grain of salt. But I'm going to be covering the levels of supervision currently under the South Dakota Practice Act. The first level is direct supervision. Direct supervision is the supervision of a dental hygienist or registered dental assistant requiring that a dentist diagnose the condition to be treated, a dentist authorize the procedure to be performed, a dentist remain in the clinic while the procedure is performed, and before dismissal of a patient, the dentist approves the work performed by the hygienist. That is direct. That is the tightest, closest relationship of supervision that we have. The next level is indirect supervision. Indirect supervision is the supervision of a dental hygienist or registered dental assistant requiring that a dentist authorize the procedure and a dentist be in the dental clinic while the procedure is being performed, but they do not have to check the procedure after it's done. The next level of supervision is general supervision. General supervision is mostly in South Dakota what most of our procedures can be done in. And so this dictates most of our practice of what we do. General supervision is where we also have the most freedom. By definition, general supervision is the supervision of a dental hygienist requiring that a dentist authorize the procedures to be carried out and that the patient to be treated is a patient of record and has had a complete evaluation within the previous 13 months of the delegated procedure. So most of the time what that means is that the dentist doesn't have to be in the office as long as the procedure is within that 13 months of the last exam that they have. Finally, we have this blanket supervision level called personal supervision. This doesn't apply a whole lot to us, but it can be used when there are certain procedures that aren't clearly defined in the State Practice Act. This supervision is defined by a level of supervision whereby the dentist or dental hygienist is personally treating a patient and authorizes the dental assistant to aid the treatment by concurrently performing a supportive procedure. Now, it says dental hygienist and it only delineates a dental assistant, but what's important to remember is that as a dental hygienist, you can act as a dental assistant, right? So we can do everything that a registered dental assistant can do plus more. So there may be times where you're working in a dental office and a dentist needs you to step in as an assistant and do a procedure with them. That would be under personal supervision and you would be acting as an assistant essentially. So those are the 4 different types of supervision levels in the state of South Dakota. Many times a Practice Act is available to the public, and this is important because a lot of the times patients should have access of what their healthcare providers are doing. Now, do most patients go and look at this? I don't know, but it is accessible. That's good for you. That means that you can investigate all these states that you want to go work in and have access to understand the supervision levels across the board. You can know what states expect what. A lot of the times now they are digital. It used to be that it was a big paper copy and that they would send it out. It was really clunky to get access to it on the website. But what we've seen now is that more and more practice acts are just easily accessible online. So if you go to your favorite search engine, Google, and type in the state you want to go, the Dental Hygiene Practice Act, it is easily available. And most of the time you can download it as a PDF, or you can, it's like a big website looking thing and you can click through the specific rules. Being familiar with your practice act is really important because most states do have a jurisprudence exam. That means you have to pass sometimes an open book exam, sometimes not. You have to pass a jurisprudence exam stating that you understand the Practice Act under the state that you're going to work in. So really getting yourself familiar with that and understanding what the supervision levels are, what your scope is essential to pass your jurisprudence exam. Now, once you pass it, it's still essential to keep up on it because things change all the time. Yearly, there's new legislation, there's new rule amendments and things that have changed because we have emerging technology. One really good example is the use of a laser. Many states are moving to allow laser use for dental hygienists, and the scope of practice that's under, again, varies state to state. So keeping up on your Practice Act is essential. You have to really watch it and make sure that things are still moving kind of with what you are practicing in your office. Another thing that can change is CE requirements or authorized practice for supervision levels. So really understanding that. A lot of the times when you go to renew your license, they'll ask you like, do you confirm that you agree, blah, blah, blah. And so every time you check that, you're confirming that you understand all of the different levels. That way, if a complaint is made against you in the future, they'll go back and say, well, you signed this when you get renewed your license. You're also signing that you are taking your CE credits, and a lot of the times they'll have a place to track that or upload that so that way they can see that yes, you are completing these specific courses and you are up to date on your expertise level. Now, I do want to give a little caveat that none of this is legally foolproof, meaning the states are assuming that you are practicing under the expertise of what you know. My favorite example of this is keeping a local anesthesia license. Many times you keep a local anesthesia license, and there are people, we live in kind of like an area where there's 4 states kind of right around us. So a lot of hygienists in my area have licenses in multiple states, which doesn't cause a problem until you get into a practice and you get comfortable. Now, the example I'm going to use for local anesthesia is, say you work at a general private practice or a pediatric office, and say you practice for about 3 to 5 years. And because you're used to doing regular 1110s on healthy patients, or a ton of child prophies, or a ton of healthy people that you do not have to numb. So you have your local anesthesia certificate and you keep up on your local anesthesia CE, but you're not actually doing local anesthesia for like 3 to 5 years. You lose your expertise, you lose your clinical ability. And so there's nothing there to legally protect you, if that makes sense. So what I'm saying is, if you move, say I decide after 3 years of that, I'm going to move and go work in a perio office. Now I have to do local anesthesia a lot more. I have to work more with the cavitron or work more in deeper pockets, something that I'm not used to doing. It would benefit you to go take a hands-on CE or have your dentist watch you do a couple injections before you do them on your own. And that's just to protect you. That is because under the scope of practice, under the Practice Act, you are saying that you are doing things within your expertise. And that's kind of a little caveat there, that you have to really make sure that you are keeping up with your expertise on the procedures you're doing. That is an honor code, right? No one's looking over your shoulder and making sure you're doing that. Now, it doesn't mean that it's going to cause a problem, but say you go in and do an injection and have a big adverse effect, big adverse reaction, maybe not even your fault, but something happened. Now that patient might have a legal claim against you that you were not practicing within your expertise, even though your license said you were. So just a caveat there, make sure that you're practicing up to the scope of practice, including expertise and CE knowledge. So that is a brief overview of the scope of practice and your Practice Act. So please, please, please do your homework. Make sure you're understanding your levels of supervision. Make sure you understand the difference between a rule and a law. Law is legislative. Rule is under the board of whatever it's called, Board of Dentistry. And really make sure that you're understanding which specific rules are relevant to you, how many CE credits you need, how many nutrition, how many local, every year you need CPR up to date. And so making sure that you are following the rules within your Practice Act is essential to maintaining your license. Thank you for listening, and I will see you on the next one.